2025 Medicare open enrollment period begins on October 15th, offering 65 million seniors new opportunities to save on healthcare costs. Leslie Dog, founder of Project Our Care, joins us to discuss the effects of rising drug costs on patients, particularly seniors. Leslie, thank you so much for joining us today. So what challenges have seniors faced in recent years regarding rising prescription drug costs?
I think all seniors know how hard it is at times to afford the drugs they need to stay alive. The pharmaceutical companies have raised prices every year far faster than inflation, and seniors pay the price. In America, we pay 3 to 4 times more for the same drug anywhere else in the world. And this year, Medicare is better than ever, and people can see a lot of savings when they sign up.
That's actually a pretty staggering figure. So can you explain the new Medicare benefits available under the Inflation Reduction Act?
I will. There are a few. Some have started last year and some start this year, but I'll just go through them. The first is vaccines are now free. So if you need a vaccine for shingles or pneumonia, and I'm on Medicare, we all do it at a certain age, those are now 100% free. They used to cost hundreds of dollars. If you are taking insulin, you could have been paying $300, $400, $500 a month for your insulin. That's now capped at $35 a month, a significant saving. And we know that a lot of seniors were cutting their doses in half or skipping their doses because they couldn't afford a drug that they knew they needed to stay alive. And another new benefit for this year, which is very important, is that no senior on Medicare will have to pay more than $2,000 a year for their prescription drugs. Now, people who had cancer or needed to take drugs that were very expensive could be spending $10,000 or more a year for their drugs. Now, nobody on Medicare will pay more than $2,000 a year, and they have the benefit to sign up so that they can sort of smooth their payments, so they don't have to pay the full $2,000 when it first comes due. They have the whole year to pay it. So these new benefits are going to keep our seniors healthy, keep them alive, and also protect their pocketbooks.
That's really interesting. So when my dad was battling cancer, the cost was absolutely astronomical for the drugs, right? Like you were saying. So to bring that down to cap it at $2,000, that's going to help so many people. All right. So what steps should seniors take during the 2025 Medicare open enrollment period to ensure that they're maximizing their savings and taking full advantage of the new benefits?
Well, they should go, I think, to Medicare.gov, which is the official government site. It's very friendly. And there, most of these things they will just get. So, if you're on Medicare, you're going to get all the benefits I just said. You got to remember to take advantage of them, but they're built in. But there'll be some choices people have to make, particularly on their drug plans, to be sure that they look at take the drugs that they know they need to take, make a list, and go see which of the third-party drug plans work the best for them. But the core benefits that I described, they just come along in the package.
Very interesting. Okay, before I let you go, Leslie, one more time, where can folks go for some more information?
They can go to Medicare.gov when they want to sign up, and they can go to our website, protectourcare.org, if they want to have a better understanding of what seniors and the rest of us have to do to be sure that our friends in Congress don't take some of these away over time.
Leslie, thank you so very much for joining us today. This has been a very, very interesting conversation. And guys, if you want to catch this segment or others like it again, head over to FCN Plus.